Hello, everyone. Welcome to our February Small Ruminant webinar. I'm your host, Sara Dzimianski with Purdue Extension in Perry County. And joining me today, once again, is Robert Kelly from Purdue Extension in Elkhart County. So we're happy to have you for part 2 of our lambing and kidding series. And we're going to go ahead and get started with that. So I will go ahead and get the presentation started. And, Robbie, if you want to go ahead.
All right, awesome. Thanks, Sarah. So today we're going to talk part 2 about managing ewes and does for birth. This kind of follows up to last month's series, and if you haven't had a chance to watch that yet, we can get you the recording, and hopefully you'll be able to find this pretty informational. I know some of you may be preparing for kidding and lambing. Some of you may be in the middle of it, and some of you may be cheering that you're done for the year. So hopefully you'll find some helpful information. So just some things to kind of remind everyone. We talked about this in brief about our last presentation, but pre-birth health check, making sure we're doing some proper vaccinations. Ideally these are probably already done for most of you, but that 4 to 6 weeks before your due date, vaccination with CDT, CD&T, checking their FAMANCHA score, making sure we have no worm problems, those kinds of things. And then if you're giving copper bolus as a part of your health program for goats, it's a good time to do that, as well as feet trimming. And then 3 to 7 days before due date, trimming long hair off the wool and tail, under the udders and those kinds of things, as well as trimming those feet. And then if you use a birthing pen, moving it and moving your animals into there. And again, just kind of some reminders for everyone is having that birth kit ready. I keep a tote in the barn that has most of the stuff in it. These are just some good items to keep on hand. Ketone strips in case you might have a lamb or doe that's you might suspect ketosis. The same with propylene glycol. It's always good to have it on hand. Kind of my rule of thumb is if you have it on hand, you're not going to necessarily need it. So it's kind of one of those things I believe in. Nutri-Drench, molasses, or Karo syrup, kind of for the same thing. Tums if you have some calcium deficiency. Syringes and needles, the dosing syringe without a needle, and then always have a phone number posted for the veterinarian, or keep it in your phone. One of those 2 resources. Some other things that are in there, probably the most important, clean towels. It seems like I'm washing towels an awful lot to make sure I have plenty of clean towels. Betadine or chloroxidine for cleaning up mom and dipping those navels, keeping things as sterile or as clean as possible. Exam gloves, you want to have some lube, flashlights or headlamps in case you're in a dark place. It's easier to see, the more light you have, the better. As well as some oxytocin, if you have a retained placenta or a labor that's stalled, and we're going to talk more in depth about that today. Having a hemostat or an umbilical clamp in case you need to cut the umbilical cord. Sometimes they're awful long on our lambs and goats, so you may clean those. And then some people use puppy training pads as well, to either to put in the pen or those kinds of things if you need those. And then, of course, we're kind of talking about mom on that front end, and then we're going to talk about the kids and what you need to have ready for them. One of the things is important, a kid or a lamb tube feeding kit in case you have to tube feed. And we're going to talk a little bit more in depth about that today. You can see the picture there, essentially just a plastic tube that's really flexible with a 30 to 60 cc syringe that you're going to attach to it. Prick your nipples in an empty soda bottle. or you can buy a plastic bottle that comes with the Pritchard nipples. It seems like those bottles don't last very long, and a lot of us, might have a bottle of empty Coke bottle or Pepsi bottle, whatever your preference of beverage is. You can have those on hand pretty affordably. Colostrum is really important, especially if you have a animal that's not producing any milk for some odd reason. Keep having a colostrum supplement there in case you need it. Milk or milk replacer, specifically for lambs or kids. They do have different nutritional needs, so try to buy one specific to that species. A hair dryer or a heating pad and or hot water bottles to warm those kids. Thankfully in Indiana, we're getting a little warmer these days. And so, but still having some of those things on hand are important. A bulb syringe, or, if you have baby kids that, using that syringe to help pull out that mucus from those noses really helps. And then, of course, a stethoscope if you need to listen to heart rate, and then a thermometer as well to take temperatures.
So now let's talk about knowing when she's in labor. So there are several signs that we look for pre-labor, and it can last a week or more. I mean, you may see this doe or this ewe being really uncomfortable. She's going, you're going to see a raised tail head because you have the ligaments in the pelvis that are softening. And so with those softening ligaments, you're going to see a raised tail head, and you're actually going to see these ligaments appear. And then about 24 hours before lambing or kidding, those ligaments are going to disappear. And so if you have a really hairy or woolly animal, you might clip that tail head. That way you can see when those ligaments disappear. You're going to start to see udder development, but this can happen a month, even 2 months before, lambing or kidding. But what you're going to see right before lambing or kidding is a sudden change to the udder. And so you may have an udder that was developed, it suddenly fills up or gets bigger. Now, with some of your older user does, they may have a lot of colostrum for weeks before lambing or kidding, and then others are going to have a sudden change. But the thing is, you want to look for them to have colostrum in that mammary system, not just tissue. So a lot of times with our older ewes and does, there will be a lot of tissue there that develops, or even with your young ones, you'll see the tissue develop. But then when it starts to fill with colostrum, and again, this is not all does will fill up right before, some will fill up gradually. But if you see a sudden change in the amount of colostrum in the udder, your lambing or kidding is likely to happen very soon. The udder will become it may get tight and shiny. This is the beginning of the birthing process. So, this is called stage 1 labor, and we call it stage 1 labor in people as well. So when you see the udder become full and shiny, you're most likely seeing this doe in early labor. So you will probably see clear to slightly cloudy mucus discharge from the vulva, but you can see this up to a few weeks before labor. This is the start of the cervical mucus plug. And so the cervical mucus plug protects the fetuses, it helps sustain the pregnancy, but it has to be expelled before the lambs or kids can be born. And you may see mild contractions. And again, you may see contractions weeks before she actually gives birth. But, we're not talking about pushing, but we're talking about, mild contractions where you see her stand up, look uncomfortable, and you can actually see that contraction on her belly. So a lot of times you're going to see her getting up and down and pawing. She's uncomfortable, she'll stargaze, and just generally show signs of discomfort. She may be grunting and groaning. Again, any of you who are moms kind of know how that feels. At this stage, it can last from 1 to 12 hours. If it lasts more than 12 hours, consider contacting your veterinarian. In general, you need to have an emergency action plan. You need to have your veterinarian's number ready, or your goat keeping mentor, probably both, and think about anything that might go wrong and who you would call. And so here is a video where we can see some of these behaviors in a ewe. It's stage 1 labor. And so you can see she's going to panting, she's having contractions, she's doing some stargazing, she's just generally uncomfortable, she's getting up, she's trying to change positions, she's kind of looking at the bedding, she's pawing, she's just a little bit miserable just because she's in that stage 1 labor. And so here she's, going to try to find a comfortable spot to lay back down. Stage 1 labor is not comfortable. So when you'll see they'll pee a lot, they're trying to relieve that pressure. And they'll just kind of generally look miserable during stage 1 labor. And again, as a mom, I can understand why she feels that way. And so once we get into stage 2 labor, we're going to see a much thicker string of mucus. And so this is the bulk of the mucus plug. And so that's being expelled from the cervix. Sometimes it'll happen in early labor, but usually I see it at the start of active labor. So typically this thicker string of mucus will be followed by the amniotic sac. So you're going to see active pushing from the ewe or the doe. She may be laying down, she may be standing up, but often they're going to lay down when they go to active pushing. Typically, they're going to either squat or lie down to give birth. And a lot of times they're going to go back and forth between squatting and lying down. And so at the end of stage 2 labor, we're going to see the amniotic sac appear, and that usually happens within 30 minutes after they start pushing. If it's more than 30 minutes, that's when you might consider calling, either checking to see if everything's okay or calling your veterinarian, depending on your comfort level. So once the amniotic sac appears, you should see the nose and the feet soon after. And typically you're going to see kids or lambs coming within 30 minutes of each other. If it's more than 30 minutes, that's when you may go in and check and see if there's another one in there, or if potentially she may be done. So if more than 2 hours elapses from the time active pushing begins, and then there's no sign of the lamb or kid, and there's another one in there, then she probably needs assistance. But again, you do have a window, because some are going to be faster than others. Most of the time they're going to be born in pretty quick succession, but not always. And if it's an older ewe or doe, she might need to rest a little bit, depending on on how difficult the first one was. Go ahead, Robbie.
So the next one we're going to kind of talk about is gauging, does she need assistance? And, this is one of those things of kind of really framing it and looking at it and, whether to act or not to act. And hopefully some of the advice we're going to give you will help. And then again, if you have questions, we forgot to mention that, questions or things throughout the program, definitely put them in the chat and we'll get to them at the end. So there's different things that can happen. Most of these can be avoided. Sometimes they're not avoidable. Pregnancy toxemia seems to be one that we can see, but one that is really, if we manage our animals right, we can help prevent this. So some things with pregnancy toxemia and what that looks like. Early stages are sometimes the does or lambs will go off feed and aren't eating near as much. They become lethargic and they might have a little bit of swelling in their front legs. And the reason that happens is that ewe or doe is metabolizing that fat because she's not getting enough energy in her diet that she needs, especially in that 3rd trimester. And we tend to see this more so with animals that have twins, triplets, mostly triplets and quads. Sometimes it can happen with twins as well. So that's something to kind of look out for, especially if you have an idea of how many babies that mother is carrying. Animals that are overweight or underweight are definitely more at risk for this. So that's something else to, when we talk about prevention on that side. Last month we talked about maintaining that body condition scoring. And at the time of birth, we really want that animal to be around a 3.5. and we don't want to push that 4 or 5 limit because we're really going to see toxemia really take its toll on that animal. One of the things too is to provide a high quality feed, including grain for the energy, and making sure that that ration is balanced for that animal. And sometimes, if you're group feeding, you may need to separate and break them into smaller groups or individual feed that animal so you can kind of really monitor their feed intake. So that way she doesn't stop eating. If symptoms appear and don't really resolve themselves, propylene glycol is something that we use quite a bit to help them boost their energy up. And sometimes and what we talked last month, if you know their due date, if they're within a couple of days, inducing that labor will help the pregnancy toxemia. One of the other things we look out for is milk fever, which is also known as a calcium deficiency in those animals. Symptoms are pretty similar to pregnancy toxemia, lots of swelling in the legs, going off feed, kind of look like they're walking on eggshells sometimes. And it occurs in that last few weeks of gestation. And again, it's common with multiple fetuses. So again, that 3 and 4 is really what we're looking at, where we're seeing more of these problems happen. And it's caused by low serum of calcium and high calcium demand. So they're putting a lot of calcium into producing milk and things, and they don't have as much in their body. So you'll also see a decreased intake and an increased calcium demand is a huge factor in that. So to help prevent that, one of the things that we can do is calcium-rich foods. Alfalfa hay is really best to help with that. Ensuring there's adequate vitamin D in the diet if late pregnancy happens during the winter months, so we can always make sure that our rations are balanced, so we can put a vitamin supplement in there. Making sure we're monitoring that feed intake and supplementing with calcium as well if we need to. And the easiest way to help an animal recover from that is just an intravenous calcium that we can give our animals, and most of the time you can get that done. So one of the questions, should we induce our animal or not? So I think one of this comes down to a best management practice of really knowing that window or that 150-day mark of when that animal is supposed to be due on average, keeping records, those kinds of things. So the rules of thumb really are, they really need to be at least 144 days bred to help induce that if she's really showing signs of toxemia or ketosis. Because the longer we can let those kids be in that animal, the better off those kids' chance of surviving is good. So making sure it's been at least 144 days if you anticipate problems and need to induce that doe or ewe. And if it's been more than 155 days since breeding and you're concerned the size of the health of the kid, sometimes the longer we let those kids cook in that oven, the bigger they are and the more problems you're going to have. So not really letting it go past that 155-day mark. So when you shouldn't induce is if it's going to be less than 144 days. So especially if the animal is not showing extreme distress. And if you don't know the exact breeding date, you don't want to really induce that animal either. So kind of one of the other things we talk about is birthing positions. This seems to be, I ran into some problems with this year with birthing positions. As you can see in our photos, the right presentation of that animal coming out is legs first and then its head. I wish every birth was like that, but we know it's not. As we progress through the pictures, you can kind of see here that you see that nose and the 2 front feet. And that typically, if it's a normal size kid or lamb, they're not going to have need a whole lot of assistance. And so this is ideally what we want to see. So we've got a video here of a normal birth that you can see here. That animal is getting ready to come out. You can see that we got feeling, so you got the head there, and then we're gonna have the legs that are gonna follow that and come right with that head. And one of the things that you could do is if you see that sack, one of the things I like to do is kind of break that so we can start to get the animal starting to breathe. And so it makes it easier for that animal to come, and sometimes you're going to have to, clear that nasal passage and get all that slimy, gunky stuff off there. And as you can see here, the lady's using a towel to help clean the animal. And as we can see, since those front legs and head came first, it makes it really easy to help that mom and pull the, and sometimes if you want to assist her in pulling it, you don't always have to, but sometimes that just helps them along with the process. So sometimes one of the other positions we see is that those hind legs come in first. This is one that tends to freak people out a little bit. You see legs but no head. That's okay sometimes. In most cases, the baby can be born unassisted, but is more difficult for that ewe or that doe. And manual guidance can help that process. I've helped assist pull some kids who their back legs are coming first. It's not quite the normal position, but with a little bit of guidance, you can go in there and help that kid or lamb come out. And you can see there in the photos just that hind leg coming out there too. So there's other positions that can cause us some worry or not worry. One of the big things I'll tell you is don't be afraid to put your gloves on and go in and assist if you absolutely need to, if you see something that might be a little troubling. So other positions that may not be too worrying is you see that nose and one front leg. You can treat that as a normal birth and try to help them come out. Sometimes, I've gone in there and positioned that other leg to come out with it because it might just be tucked under a little bit. And that helps that come out a little bit, especially when you have yearlings that it's their first time kidding or lambing. Sometimes that happens and they need a little assistance getting that out. Hocks first isn't ideal, but you can do that with a little bit of assistance getting those kids out and getting them. Two back feet with the dew claws down. Again, you can turn those legs just slightly to get them to pull them out. I don't think you have to go fully in and reposition them, but you can do that sometimes. One of the what we call a true breach is when you see that tail come first. That's when I start to get a little bit worried. When you see that tail first, ideally you're going to need to put some gloves on. You're going to need to go into that ewe or that doe and try to push that animal, that kid back in and to reposition them. It's hard to do that if this is the first time you've ever done that. Even if it's something that you've done 100 times, as you're going in there, you're in the dark, you can't really see. So you're really going to have to know the anatomy to help feel for that animal. And sometimes it can be hard to tell that. Two front feet, but no nose. The head is back and it might need to be repositioned. I had a little bit of that happen this year to me. I had some feet, no head. So I had to go in there and kind of feel, for the head to kind of help pull that head around and get them to come out with those feet. And the same thing with spine first, really that kid's coming sideways. You're going to have to go in and try to reposition. I think one of the biggest keys with any of these positions to not freak out, because the more you freak out, the more you're going to panic yourself. So try to keep calm and say, okay, I got to do this. Ideally, if you've got a doe or a ewe that's pretty calm and is laying there for you, that's great. Once in a while, I will tell you, you will have to restrain the mom. Use a halter or something to tie them up so that they don't really try to move around on you. And if you can have another person kind of help hold that animal too, makes this process go much smoother. unfortunately, I was the only person pulling an animal this year out of one of our does, and it was not fun. She was trying to run around the pen, so making sure you tie the animal up first is important. Head with no front feet, trying to reposition and get those feet to come forward as well. Are some of those other positions that we can see and try to go in and manipulate. And don't be afraid to do that. And if you're not comfortable yourself doing this, and you have a person who might be your mentor or a neighbor that's had lambs or goats give birth, giving them a call, because once you're in this position, you're in that stage 2 active labor birth, you don't have a ton of time to be sitting around waiting. If you need to call a veterinarian for assistance, they're going to make it a priority to try to come out and help you. But the big thing is, don't wait too long if they're starting to give birth and you see these different positions, because you can compromise losing that lamb or that kid. So signs of having difficult birth problems. One of the big things is if we've had more than 12 hours lapse following the start of stage 1 labor. So if you go down and you see, I'll use myself, for example, I had a doe about a month ago. She started to lose her mucus plug about 9:30, 10 o'clock at night when I was down in the barn. I'm like, okay, she's going to go tonight. So I, stayed up and watched our cameras, paid attention to those. By the morning when I was down there at 5:30, 6 a.m. to go feed, she hadn't really progressed. So I watched her a little bit more, watched her a little closer, and decided it was time to intervene. So making sure you're watching that time, and especially if more than 2 hours is lapsed in between the start of pushing and delivery. That's the time you want to go in, see what's going on, because a lot of times if that kid isn't positioned right, or that lamb isn't positioned right, it's naturally not going to allow her to necessarily progress and push as much. So you're going to have to go in and maybe assist that animal to go in there and get that birthing process moving along. So again, most of the time we're having multiples. So 30 minutes between kids or lambs is important. And then 30 minutes after that sac appears. And if you don't see any body parts, the legs or the head coming, you need to start intervening. Signs of distress, excess blood. The doe or the ewe is laying there and she's pretty lethargic and not really moving along. So those are some things to look out for. And then, of course, we talked about the different birthing positions and when we intervene there. So with difficult birth, you can see this video here. So she's been pushing without really, a whole lot of progression in her labor, as you can see. So as we look at this, we can see that this doe is really straining to have her kid. And this is one of those ones you might want to start looking at intervening, seeing what's going on there. Do you need to help pull that kid? Is that kid coming out right? We can kind of see some of the feet there in the video, especially when you have first time animals giving birth. Is really important to really pay attention and try to monitor them.
So this footage has been sped up significantly. And so now after a certain time of waiting for her to kid naturally, then you go in and check. In this case, we had a very large kid with the shoulders stuck. And it actually, sometimes it will take some effort. If you have a very large one, you have to be gentle, even if you are putting significant traction. So, and the key is, you want to make sure that you are always, if you have to pull, you pull toward the hocks. And you're not pulling all at once. You're going to work with the contractions. And so, once the shoulders come loose, then the rib cage comes pretty easily. But then if you, in this case, where you have a very large kid proportionate to the doe or the ewe, then you have the hips catch as well. And so it may take additional maneuvering to try to get the hips out. And you don't want to be in a hurry to assist, but at the same time, you don't want to wait too long. And so it's finding that balance.
Yeah, absolutely. And like you saw in the video and Sarah had said, and that sometimes that front catches and then sometimes those back are really hard to get out, to give a little assistance to, especially if it's a big kid. And so trying to figure out if you can do ultrasounds. Sometimes the vets will be able to tell you if there's more than one kid in there. And if there's only one kid, you definitely kind of worry about the size a little bit. So manually repositioning lambs or kids, Sarah kind of had mentioned this not being too much in a hurry. And the reason I say that and she also mentioned not being too forceful, is you really want to make sure, if you have to go in and assist, that we try not to tear the uterine lining, because once that's ripped, unfortunately, it's kind of a death sentence for that animal, and can be done in a way that we don't put that animal at risk. So one of the big things is making sure your fingernails are trimmed and covered, while you're repositioning that animal. One of the things I also mentioned, especially for ladies, try not to wear your wedding ring, because sometimes, if you've got a diamond or things that stick out from that, that's just more potential to damage that animal. So suggesting not wearing your wedding ring in the barn. I know my wife, I always tell her she leaves hers off during kidding season and wears just a rubber one, just in case we have to go into an animal. Making sure you use lubricant. That's important too. That way it helps with the, there's not as much friction there and we're not tearing things. Small hands are best. So, if you have bigger hands, it's a little bit harder. If you've had to go in one of those animals, so the smaller hands, the less we're dealing with that extra potential. And again, before you go in that animal, making sure you're washing your hands and put gloves on to make it as sanitary as possible. The best thing to do is kind of, when you're starting to feel in, you only want to go in with a couple of fingers into the vagina to gently work the entire hand in there. And again, that's where the lube comes in to help loosen that up and make it a little bit easier. Then you want to feel kind of what body parts you're looking for. And again, it's kind of hard because you can't open it wide up and go in. So feeling what body parts you feel. Do you feel the head? Do you feel the spine? Do you feel the tail? And ideally, again, we want that face and that head to come first. So trying to reposition that animal so you feel those through there. So a little bit more about manually repositioning. So if we've got our head backward presentation, you want to gently push the entire lamb or kid back into the uterus there to help find the head. And then you want to kind of try to find the feet to pull, to reposition that animal, to get it to come back into that birth canal, at least that one leg forward, but ideally both of them. And again, that true breech, if you're seeing that tail presentation, if the lamb or the kid is large enough to give trouble to the ewe or doe, you want to push that animal back in there and try to reposition it. So you can ideally get that head first, but if you need to move those legs down to get that hind feet into the birth canal, then again, using Mother Nature, and as that doe or ewe is contracting, is really when you want to start to help pull and assist. You don't want to work against the contractions. You want to work with them because that's going to make the process just a little bit easier for those animals to come out. So you've got a head-only position. One of the things you want to do is go in there with your hand and see if you can feel those legs and feet that are, might be just tucked under a little bit, and you can kind of maneuver them back just a little and try to get that leg bent to come forward as you go into that birth canal, so you can gently pull that animal out as that doe or ewe is contracting. If you have 2 feet at once but no head, the big thing is you want to determine, do you have the hind legs or do you have the front legs? Feeling which one to come first, which would be the easiest to deliver. Sometimes it's just easier to let them come the back feet first to pull that way, but ideally give them with that head and those 2 front feet. So making sure we're having them in a right delivery mode. So when to call the vet? That's the question we sometimes struggle with, and again, it's that fine line. And if you're not comfortable and you see some of those positions before, I'm going to highly suggest you call the vet to help you out. During that pre-labor, if that animal is really weak or lethargic and is not responding to any treatment you've done, that's a good time. When you have excessive bleeding and you're not sure what's going on, they're going to give you advice and tell you, they're planning to come out and look at it. And again, if that stage 1 labor has gone more than 12 hours and the cervix is still closed, she's not progressing like she needs to, getting that vet involved, the sooner we get them involved, if you're not sure what's going on, the better off the chances of the mother and the kids are going to be for survival. So during or post labor, sometimes, if the kid is too big to be delivered, even with general assistance, you're really working, you can't get that animal out and you just simply can't pull the kid or lamb out, call the veterinarian to help you there. If it's in a position that makes delivery impossible, I had one of those this year that was a spine first, and I couldn't get her turned, end up having to call the veterinarian to do that. And then, if that lamb or kid might have a defect or that doe's going into shock and she's just really going downhill, it is really important to, get assistance where needed. So again, how to assist. You want to make sure that you wear some gloves to help protect you and the doe. As we can see here in the video, we've got some gloves on and we're going in slowly, 2 or 3 fingers to help that, making sure we're going in gently. You want to ensure that you have both feet when you're in the head, that the animal's positioned to help pull that animal. And again, it's go slow and go with those contractions. It's important to get them out quickly, but you want to do it in a safe, efficient manner when we're doing this. So once that kid is out, make sure that water sac is away from the mouth. If you don't hear any noises, tickling that nose with some straw to get the lamb to take a breath. Sometimes I'll take, as we can see here, we're pulling the lamb out, getting them positioned. I'll take a towel or whatever, and I'll really wipe the face. And we'll back away from the mother to let them be able to see the animal, especially if we've had to assist. Sometimes too, I've seen people do the method where we hold them up by their hind legs and kind of rub their lungs and get all that stuff off their mouth too, to really get them breathing. Because sometimes, especially if it's been a hard delivery and we've had some dystocia problems, we're gonna really need to get that kid vitalized. So as we can see in the video, we got the 2 legs and the mouth coming out, the head. And then our person there is just cleaning the face to get all that mucus away from the animal so it can breathe. As you can see, the ewe gets up as they were getting the kid out there and kind of cleaned off for mom to help take care of it. So one of the other questions is, do I need a C-section? So most large veterinarians can do an on-farm C-section. Once in a while you have to have those done. Either the kids are just simply too big, mom's too weak, any number of things there. If a C-section is required, you do want to have a clean area, just like in the birthing room. You do want to have a clean area for that veterinarian to be able to go in there. We're putting that doe or that lamb at more risk just for potential exposure, because we're going to open her up, and the insides that are typically never exposed to the outside world. We want to make sure we can do that as sanitary as possible. So one of the big things is you want to stand by with plenty of clean towels to be able to help clean those kids off, get them clean, get them breathing, and you want to make sure you follow the instructions of the veterinarian there. As you can see on the picture on our slideshow, you can see there with a doe that has had a C-section where they've shaved her to be able to get in there, can make a clean cut, and try to be as sanitary as possible. So what's next for mom after that stage 3? We've gotten through lambing and kidding. The next thing we want to be on the lookout for is making sure we pass that placenta or the afterbirth. It should happen within roughly 6 hours of that lamb or that doe giving birth. If we don't have that passage after 6 hours, do not attempt to pull it out. I would give your veterinarian a call. Most of the time they're going to tell you that it's probably just, we just need to give a simple dose of oxytocin. Sometimes they may recommend something else, especially after that 24-hour mark. So what's next? Bonding with the kids is important, or the lambs. Making sure they have some time to bond with them. Making sure that their nursing is really important, and we'll talk a little about colostrum intake. And they should immediately really want to pay attention to each other and to help them get vitalized. Sometimes when you've had a doe or ewe that's had a rough kidding or lambing, you may need to give the mom or the kids a little bit of assistance. Sometimes you can supplement that mom, especially to get her energy back up, is with warm water and molasses to give them some of that energy. A quiet space is ideal. Ideally, if you have a pen that you can put them in where they're by themselves and not mixed in with others, is definitely one of the best things you can do. Sometimes, that's not always possible depending on your setup.
So what's next? Lambing or kidding is done. So what do we do now? Well, one of the first things we need to consider is newborn care. And now, if it's warm outside and they're out in the pasture, you may not need to do anything, and that's just fine. We have some breeders that are breeding deliberately for very hearty, sheep or goats that don't need any assistance. And so you'll even have some that'll lamb out in the pasture in the middle of winter and be just fine. But if you are not one of those people, if you're lambing or kidding in the barn, if it's cold weather, you want to make sure that you help her get those kids or lambs dry, because a lot of times, they really have a hard time getting dry fast enough to avoid losing body heat, especially if you're, like the week we just had of the polar vortex all the way down to Texas. And I know we have people from a lot of states that joined this, but if we have temperatures in the single digits and that's when she chooses to lamb or kid, then she is going to need some help getting those lambs or kids dry enough, fast enough to be able to keep them warm. And so if they're going to be dam raised, then make sure that she has those lambs or kids in front of her where she can take care of them. And most of the time, as soon as she has that lamb or kid, she's going to turn around and start licking it. And so you want to make sure that she is following her instincts correctly, that she is not ignoring them. If they are very weak, you want to monitor them carefully and determine if they need additional assistance. Now, you don't want to give them assistance unless they actually need it. And so you want to make sure that they have colostrum within the first 12 hours, preferably sooner, but they have to have it within the first 12 hours. What happens within the gut is right after they're born, they have large openings in the intestines to be able to absorb these large proteins, immunoglobulins from the colostrum, but those go away after about the first 12 to 24 hours. And so they can't absorb as much from the colostrum after that first 12 hours. So it's essential that they get adequate colostrum within that first 12 hours. Before lambing or kitting, you need to decide if you're going to dam raise or bottle raise. And so this is more of a dairy animal issue. So most of you, if you're raising meat animals, you're going to be dam raising. But if you're raising dairy goats or dairy sheep, then a lot of people do raise on a bottle or a bucket, so they can milk the animals and have tamer, lambs or kids. But even if you're planning on dam raising, there are always going to be a few that can't raise their own, whether it's an issue with the doe or the ewe herself, or whether it's an issue with the lamb or the kid. And so you need to have a bottle prepared just in case. And you also want to make sure you have a source of colostrum available just in case. It could be colostrum replacer, which, while not ideal, is better than no colostrum at all, or colostrum that's contaminated with a disease like CAE or OPP. And so you want to make sure that you have a disease-free source of colostrum. I like to keep colostrum from an older doe from the previous year, because an older doe or an older ewe is going to have more antibodies in her, more immunoglobulins in her colostrum than a first timer, because she's been exposed to more. So I like to save colostrum from an older doe and put it in the freezer for the next year. That way I have an emergency stock of colostrum just in case I need it. One thing you may consider is assisting with a first nursing to make sure that they do receive colostrum. Most of them will be able to stand and nurse on their own without assistance. But if you have a doe or a ewe with very large teats, then they may need assistance for a while to be able to learn how to nurse. And in this case, if you have a doe or ewe that is a poor mother, or she has very large teats where the lambs or kids don't nurse, you're probably best off culling her. But sometimes you don't know that until after they kid for the first time. And so consider culling her, and depending on your breeding goals, you might cull the kids as well, or the lambs as well. But just kind of think about that. So if you do have very weak lambs or kids, then we'll talk about some tips for taking care of them. And again, if you're uncomfortable, if you've never dealt with weak lambs or kids before, consult your veterinarian or your mentor, or both. But the first step we talked about before, we want to make sure that we clear the face of the fetal membranes, and we want to make sure that the nose is clear. Rub them vigorously with a towel and check for a heartbeat and blink reflex. If you have a heartbeat, and say it's very cold, but you can feel a weak heartbeat, sometimes if you just get them warmed up, then that can help them recover from the stress and they'll be fine. And so you don't want to even try to tube feed unless the lamb or the kid is warm. And so if they don't stand within an hour, that's when you want to hand feed colostrum. And now, depending on how strong or weak they are, you first try with a Pritchard nipple. And so see if they have the sucking reflex themselves. If they have the sucking reflex, a nipple is the best option. If they will not suck, that's when you're going to tube feed a small amount of colostrum. And so if they're very weak, you might give them vitamin B complex or Bose at your veterinarian's directions, depending on the issue. Because one thing we see is white muscle disease, which is caused by selenium deficiency, and that can cause very weak lambs or kids. And so again, you want to consult your veterinarian before you use either of these. If nothing else seems to work, you could try a little Caro syrup or other sugar source under the tongue, or glucose under the tongue every 5 minutes. Sometimes their blood sugar will drop really low. And if it's very cold outside, like the temperatures we had the past couple of weeks, you might need to bring them in the house to get them warmed up. And so if, in a last resort case, if you cannot get colostrum into them any other way, if they will not suck, if they have no suck reflex, then you can tube feed. So the first key, you want to make sure that the kid or the lamb is warm. And you want to make sure that the tube is long enough to reach to the animal's last rib. And so you'll position the animal kind of between your legs and your hands, so the head is above the stomach. And you want to gradually insert the tubes. The animal should easily swallow the tube. Don't force the tube down the animal's throat. If you force it down the animal's throat, there's a good chance you're getting it in the windpipe. You don't want that to happen. So you do not want the tube in the trachea. So you want to make sure that it's placed correctly. So once you make sure that the tube is in correctly, you're going to attach the syringe to the feeding tube after the tube, again, is fully inserted. And so you're going to take the plunger and you're going to push down. And if it's placed correctly, it should be difficult to push it down. If you're in the wrong spot, it will be easy to push the plunger down. And at this point, if it's ready to, if it's ready to go, if it's all correct, you can start to administer the milk. And again, let gravity work, and don't try to do it too quickly. Okay, so let's talk a little bit about some things that we might do shortly after lambing or kidding. So lamb tail docking is something that a lot of our wool sheep producers are going to do. And so the reason why people might dock tails is that it prevents fly strike with wool sheep and it improves cleanliness. It does cause pain at the time of the procedure and during recovery. And if you dock too short, there may be problems with rectal or vaginal prolapse. So the key is you want to make sure that if you are doing this procedure, you know what you're doing and how you're doing it. You're doing it in a way that minimizes pain to the animal. And so there are various techniques you can use that people use. Some people use an elastrator, and depending on the site where you put this, there can be varying levels of pain. The pain tends to last longer with an elastrator band than other methods. A hot blade with a heated anvil scissor docking iron that will both cut the tail and cauterize it. This is your lowest pain method. And so it's probably going to cause the least stress on the animal. And then there's also banding combined with crushing, where you're using a bloodless castrator to crush the tail for about 10 seconds before applying the band. And typically the band will roll into the groove made by the bloodless castrator. This appears lower pain than banding alone, but both of the banding techniques are going to be higher pain, and they're not the recommended technique. The hot blade is the recommended technique for tail docking with sheep. This budding goat kits, so it's very hotly debated within the goat community. There's some pros where you have safer handling of animals. Horns can cause a lot of damage both to you and to other animals. The animals are less likely to get caught in the fence, and being caught in the fence can make them susceptible to predators or, starvation or, thirst, depending on how soon you find them. And then the animals are less likely to hurt one another. So the cons of disbudding, you have pain at the time of the procedure. They may have a lower ability to defend from predators depending on where you live. And there's some suggestion that there may be reduced heat tolerance because horns can function as a cooling mechanism. I haven't seen a lot of evidence for that, but that is a claim that is made against disbudding. If you are going to disbud, you want to make sure you have a very hot iron to do it, and talk to your veterinarian about pain management. Castration is something that we see a lot in the 4-H world, where intact males are not allowed to show. There are a lot of good reasons for castration. You don't need very many males for breeding comparatively. Not all of the males are the quality that you want to use for breeding. It will lower the aggression, because you don't have that testosterone there. And you can live with the dam longer if you're raising out meat animals, since there's no risk of accidental breeding. And again, you can keep all of your lambs or kids together since there's no risk of accidental breeding. And there are various methods of castration. You have surgical castration, which is the recommended way to castrate. It can be done at any age and generally provides the best results. Banding, it must be done on young animals while they're small. You must use fresh bands and make sure that all of both testicles are included in the band. I've seen instances where banded lambs have become sexually mature and have impregnated ewe lambs because it was not done correctly. But you do want to be careful not to include the teats in the band, and there is a higher risk of infection with banding. There's also crushing with a bloodless castrator. It is a bloodless method, but it's more difficult to ensure that this procedure is done correctly, and there's more pain than either of the other two methods. It's generally not the recommended method of castration. And then you want to make sure that your lambs or kids are vaccinated. And so if the dam received prenatal vaccine, you'll wait until 5 to 6 weeks of age for your first CDT vaccination. And then you'll repeat at 9 to 12 or 9 to 10 weeks, and then every 6 months thereafter. If the dam did not receive prenatal vaccinations, then you want to give your first CD&T at 2 weeks, and then the second at 6 weeks, and then every 6 months thereafter. And then tetanus antitoxin is something you would want to use at disbudding, castration, or docking, because the toxoid, which is what's in the CD&T, will not provide protection soon enough for disbudding, castration, or docking. So for more information, there are some resources, and we'll find a copy of this presentation in that shared Google Drive that will be, and a link will be emailed to you shortly. And we'll go ahead and take some questions, but make sure that you join us next time for Lamb and Kid Early Feeding and Nutrition, and join Purdue Extension Forage Forum Fridays. And so it's Purdue's specialists and industry specialists are going to be talking about some forage topics each Friday at noon. Okay, let's take a look at the chat box and see what questions we have. Okay, this was recorded, and so it will be posted tomorrow on my YouTube channel, and there should be a link to that. But I will post the YouTube link on my Facebook tomorrow. So what can be done with genetic selection and structural assessment when purchasing breeding stock to reduce dystocia? Robbie, do you want to take that one?
So can you say that one more time? I only caught part of that.
Discuss what can be done with genetic selection and structural assessment when purchasing breeding stock to reduce dystocia.
So I think that's a great question. Some of the things, especially with genetics, I try to when I'm selecting animals, one of the big things I select for is mothering ability, especially in the does that I'm keeping. When you're selecting animals, the wider the back end, the hips, and especially on goats, making sure they're not too steep rumped, making sure there's a little roll and a pitch to there, and making sure they're not completely level hipped either is important. Goats naturally are supposed to have a slight angle to them. Making sure that we're looking at them, they're going to be wide. Sometimes they grow into that, so it's a little hard to tell on younger ones, but a wider based animal always helps out a little bit for me when I'm going through. And then if I have a doe that's kidding and it's her first time, she needs a little bit of assistance, okay, no problem. But if I'm running into that second, third year of some assistance with that, I'm probably going to call that animal, just because that's my practice of, just because they've had trouble once doesn't mean they're going to have trouble again. But if you're having trouble every year, it may not be the best to keep that line in your herd or flock.
Okay, the next question is, are there breeds of sheep and goats more prone to birthing problems? Now, I don't know that there's been any research that's established particular breeds, but I do know that the miniature breeds of goats tend to be more prone than the standard breeds. That is, a lot of the miniature goats tend to be overweight at the time of kidding, And so they tend to have more weight-related problems with getting. And I believe that wool sheep are a little bit more prone to problems than hair sheep. And boers tend to be problems than your other meat goat breeds. Again, for a lot of the same reason that miniatures are, because people tend to keep them too fat. And fat goats in general, or fat, are going to have more problems. Rob, do you have anything to add to that?
No, I think that's a pretty good answer for that.
Okay, another question. We were told not to give alfalfa the last month of pregnancy. Is this true? What is your go-to feed on a goat that last month? That's kind of a, alfalfa can be fed, but the only source of hay. In fact, with a dairy animal, you might actually begin reintroducing it. But the issue is if you have too high of protein in the diet, you're going to have increased kid or lamb weights. And so you want to have a balance, but on the flip side, increased protein in the diet can reduce problems with parasites in newly parturitioned ewes or does. And so it's a balancing act. So I wouldn't feed 100% alfalfa as your forage source, but it can be okay to feed some. The issue with alfalfa is if you have with calcium deficiency. If you're feeding some calcium but not enough calcium, which can be the case with feeding alfalfa in the last month of pregnancy, then you can end up with calcium deficiency in the serum. If the diet is not rich in calcium that last month of pregnancy, then they will be pulling calcium out of their bones. So it triggers them to pull the calcium out of their bones so they have a high enough serum calcium level. And so the key is making sure that they have enough calcium in their blood serum. But again, I typically like to feed some alfalfa, but not free choice alfalfa during that time. But there is some debate, and I don't know that there's been good research out there to say for sure. Okay, so every 6 months for CD&T vaccinations. So while the label does say annually, there is some evidence that CD&T, does not protect for that full 12 months. We've seen a lot of people that have actually had losses to enterotoxemia that vaccinated every 12 months. And so there's some thought out there that it needs to be given more frequently. Typically, I plan on giving it before breeding and before kidding for that reason. You can give it annually, but every 6 months is going to give you a bit more protection. And so I'll have to look up those studies for you and post them, post them later, but I can get back with you on that. So any other questions?
There are a few more in here. Someone asked about how much calcium, and I don't know if that's referring to having to treat or not. So I don't know, what would your recommendation be for that, Sarah, if you had to treat for a calcium deficiency?
I would work with your veterinarian, and it depends on the product. But I would work with your veterinarian on the dosage there. Okay, so in regards to preventing ketosis and providing adequate nutrition for the ewe, I read that for ewes in late gestation, you should provide a pound of grain for each fetus that they're carrying. Is that accurate, or is that too much grain for them? I think it really depends on the ewe, and in general, that seems like a fairly high grain ration for a ewe that's not in lactation. I would think that would have difficulty eating that amount of grain. That, as the pregnancy progresses, you have less capacity in the stomach. And so their intake is going to reduce. If you feed too much grain, then you're going to have potential for laminitis and other issues. And so it's really going to depend on the body condition score of that ewe. And I would definitely work with a nutritionist on determining what is the right amount of grain in the diet. So for propylene glycol as a product you recommend for goats, I can only find one for cows. I know there are some products for goats, and I'm not sure that they have propylene glycol in them, but Nutri-Drench provides some energy, and that could be helpful. Do you have any recommended products, Robbie?
Most of the time, I forget the name brand is, but most propylene glycol that you can find that's for cows is plenty sufficient for goats. It's really just a high energy supplement. And if you can't find one, I will use a Cairo syrup recipe that I have and just drench with that too.
So I noticed some cloudy mucus coming from my ewe last night. Does that mean she's in the first stage of labor? Not necessarily. You can see mucus for a month before labor actually starts. It just kind of depends on the individual animal. Is there anything people seem to be missing a lot of in their kidding kits? I haven't surveyed people on what they have in their kidding kits, but there are some things that are more vital than others. Kind of your towels and your iodine and clips, those are kind of the most vital things. Gloves. The things that may be a little bit more difficult are the things that require a veterinary prescription, such as oxytocin. If I usually clip feet by turning the doe over on a sheep chair, is it still okay to do this prior to birth? I will say they are never thrilled about this. I worry I might do more harm than good. So the position itself shouldn't be a problem. The question is, how much stress are you putting on this ewe or doe in this case? And so I would probably try to keep stress as low as I can. And so I'd probably put them on a fitting stand to trim personally, rather than using a sheep chair. So aside from the IV for milk fever, which I have to rely on my vet to do, is there a product that I can buy to feed the goat while the vet is on the way? There are some oral calcium gels, but those aren't going to be as effective as intravenous calcium. So if I confirm pregnancy toxemia via ketosis strip, please repeat what to administer. So that would be, again, you want to make sure that they're eating, but propylene glycol, ideally, or another sugar source. You want to get the glucose, in their blood. You want to get their bloodstream working off of glucose, not off of ketones, or for their energy source. And so propylene glycol is converted to glucose, but any source of glucose can work. When do you need to cut or clip the cord? Is it mostly handled by the doe? Yes, the doe handle it most of the time. So sometimes you will have a doe or a ewe that will bite it off really close to too close to the body. And so in that case, you'll need to clip it so that you'll need something like a hemostat to stop any bleeding if it's too close to the body, and because it may not heal over as well, or if it's extremely long. So if it's more than about 2 inches long, then you're going to want to trim it shorter so it doesn't cause problems. So do you have anything to add to that, Robbie?
No, yeah, I think that's the big thing. And sometimes, I'll let them in the pen just for a little bit, even if it's a little more than 2 inches. Within the hours when I try to cut, I don't cut it right away. But I do it before I dip their navel, just to make sure it is short enough, because sometimes you can end up getting a hernia in there, and that's not pretty either. So.
Any other questions?